What's up guys, it's Derek Z, physical therapist, and today in this video we'll be talking about crutches and how to use them safely and effectively. People usually end up having to use crutches because of an injury that they had to their leg or because of surgery. When it comes to surgery and they're using crutches, there are sometimes weight-bearing precautions deemed by your surgeon. Usually it goes like this. There's non-weight bearing, there's toe touch weight bearing, there's partial weight bearing, and then there's weight bearing as tolerated, and then there's full weight bearing. The names in itself pretty much explains what your restrictions are, but we'll go through them one by one. So non-weight bearing is when you cannot put any amount of weight on it. Toe touch weight bearing, usually that's about 20%. I have seen different numbers, but clarify this with your surgeon. Toe touch weight bearing, in other words, you're just putting your toes on the ground. Your toes are just touching the ground as you're walking. Partial weight bearing, the surgeons that I have worked with, that usually means 50% or less. Again, clarify that with your surgeon just to make sure. Partial weight bearing, sometimes if they say 50%, then you essentially get a scale, put 50% of your weight on it so you know what that feels like, and that is the amount of weight in which you can put on your leg. Weight bearing as tolerated, that usually means you can put as much weight on your leg as you're comfortable with. And full weight bearing, the name in itself pretty much explains it. You can put all of your weight on your leg. Crutches are usually recommended for individuals with a good amount of upper body strength. The reason I say this is because every time you take a step with the crutches, you're essentially doing a mini dip. So however long you're walking, you have to dip your way all the way to your destination. The profile of patients that I usually see that are using crutches are usually younger, more athletic, and have adequate upper body strength. With that said though, that is not absolute. I have seen patients previously in their 50s, their 40s, sometimes even their 60s, where they do have that adequate upper body strength to be able to get themselves around while they're using crutches. It's just not very common that I've seen that. At the end of the day, it just depends on how much upper body strength you have.
Let's talk about fitting yourself to the crutches first before using them. The underpads should not be right up into the armpit because there are nerves there that are prone to being compressed, and that is no good for your arm because you'll experience some numbness and tingling. You should have about 2 to 3 fingers width below the armpit for comfortable use there. That should be good. This is from the side. Again, should have about 2 to 3 fingers width below the armpit. That's where the underpad should fit. And your shoulders should stay nice and relaxed. The buttons on the bottom of the crutches are labeled for the appropriate height. However, I find that sometimes going up or down one click will work better for some individuals. So play around with what feels the most comfortable. At the end of the day, you're going to be the one that's using it. When you have the underarm pad in position and your arm is straight and you're ready to walk, there should be a little bit of a bend on the elbow. I usually tell people about 20 degrees or so that way your arms can stay nice and relaxed. The wider the crutches are, the more support you'll have. The narrower they are, the less support you will have. Find what's comfortable for you in between the two extremes. If you have a non-weight bearing restriction, your crutches will go forward first in place of the injured leg. Then you swing your body forward while you have the support from the crutches. You can either hold the leg up straight or have a little bit of a bend in the knees, assuming you are allowed to do that. Holding the leg out straight though is going to be a little bit harder because it requires a little bit more muscle activation. If you are partial weight bearing or toe touch weight bearing, I usually teach people to figure out how much weight to put on their leg by using a scale. So for example, here I'm about 145 pounds. I step on a scale and then I step off of it to kind of figure out what half of that is. So I basically put about 70 pounds of weight on that. So then that way I know how much weight to put on that leg and what that feels like as well. So not everybody's gonna have a scale at home. If you don't, that's fine. Again, at the end of the day, if you're toe touch weight bearing, you're really just walking with the crutches while your toes are just touching the ground. You're barely putting any weight on it because you're just toe touch weight bearing, just as the name implies itself. So if you're partial weight bearing, this is how you would be walking on it. Again, clarify with the surgeon what partial weight bearing means, and then to figure out how much weight bearing it is, you just use the scale like I shown before to kind of help you figure out what 50% feels like or what 75% feels like. The scale will guide you and let you know how it feels. For weight bearing as tolerated, this is pretty self-explanatory. You can apply as much weight as you're comfortable with the injured leg. When you get to this stage, the crutches are more so there to help you with a little bit of support and balance versus you actually needing them to walk. This is the stage where you can progress to one crutch once your pain is well managed, healing process is taking place and is solidified, or your doctor or your PT clears you to do so. When you're just using one crutch, just remember it is on the opposite side of your injured leg. So if your right side is injured, then you use the crutch on the left side. You advance the crutch with the injured leg to provide a counterbalance to support it. This is pretty much when you're weaning away from crutches. When you're doing stairs using crutches while you're non-weight bearing, get as close to the step first. Take both the crutches, put it on one side, use the handrail if there is, and empower yourself up from there. When you're doing downstairs, get as close to the step as possible, put the crutch down, and then slowly lower yourself down. From there on, you can take both the crutches and resume walking as regular as if you're non-weight bearing. If there isn't a handrail available, then you would basically navigate up the stairs similarly with just both the crutches, just like that. When you go down, put both crutch down first, make sure you're nice and stable, and then slowly lower yourself down. This is how you would be doing it if you're non-weight bearing. You can't put weight on the other leg, and you have to navigate stairs with both the crutches. One more time coming up the stairs like this, get yourself as close as possible, come up with both the crutches, and then stabilize yourself as you're going down, and then slowly lower as you're coming down the step. When you're trying to sit down on a chair as you're using crutches while non-weight bearing, what you want to do is back up to the chair so you feel it behind your leg, so that way you know it's behind you. Get the crutches and get it to the opposite side to your injured leg so you can counterbalance. Put your hands on the armrest and then slowly sit yourself down so then that way you're safe. When you're getting up, it's basically the reverse process. Use the crutches on the opposite side to your injured leg as counterbalance, because when you're getting up, you're essentially doing a single leg squat.
Alright guys, this is how you safely and effectively move around with crutches. Please like, comment, or subscribe if you enjoyed this video, and please let me know if there's any other topic you would like me to cover in any upcoming videos. Thanks for watching. See you in the next video.